So first, before you do any skill, Dr. Hi, my name is so and so. I'm gonna, be doing whatever procedure. You wash your hands, you don your gloves, you ask your patient what's their name, their date of birth, and then you start. Right? Perfect. So we just make believe that just happened, and we did it. Pass me some medium sized milk. Okay. I'm just gonna bring this over. So
Yeah, okay.
I'm gonna use the that you're gonna insert the NG2 with them laying like that.
No.
Okay, so now you're gonna actually mix that. Of course, you explain the procedure to your patient, tell them what you're going to do. Everything that you're going to do for a patient, you have to let them know first. Because if you just come into a room, put a syringe and a needle, like a syringe this big, and a needle, and you're like, sir, turn over. They're gonna be like, what in the world are you doing here? So you have to explain everything. So, sir, I'm gonna be doing the NG2 insertion for you as the physician ordered for you because of this situation that you have, etc., etc. Okay, no problem. They did tell me that. That's fine. So you lift up the head of the bed. Oh, sorry. This one. Okay. Make sure
What is the name of that?
this is
Gauge.
syringe.
Syringe?
A syringe, yeah. Okay. So you want to make sure that if your patients slid down, you want to put them up a little higher. It's a mannequin, so it's fine. Because the lower they are, their neck will be like this. So put them as high as you can put them. Let me put there. You can put them. Fowler's position is the best position because that prevents from them having to aspirate anything that you actually, pull out. Well, I think this is the highest it can go.
Sure.
Oh, there it goes. Okay. All right. I don't know if I can go this high on these mannequins because they're like rubber. Okay. All right. So once you do that, of course, where you're gonna work on the side that you're gonna work. If you're right-handed, you have to be on the right side because it makes it much easier. If you're gonna stand on your left side, think about it. You're gonna be using this hand, and that's your left hand. It's not gonna be easy to use. So wherever you're doing something, if you're right-handed, stand on the right side because that helps you to do even the IVs. See, my right hand, I go this way. If I'm left-handed, how am I gonna? I'm gonna be like this. No. You have to be comfortable. So right side. All right. All right. So I'm gonna put this down because it makes it easier to work with because I can't work with it going like that. All right.
How do you do this?
No, you don't put
that down.
Huh?
You put
I'm just gonna
one
use
side
this
down.
temporarily. They just put this here to hide it. So you want to make sure that you do have like a chucks or a towel, so in case if it does get messy, you put it under them here like that. All right. All right. So I have my kit here ready. So when you're doing the procedure itself, right? How do you know that you're putting the exact amount of tubing into the patient? Because everyone's dynamic is different. My length versus your length of your esophagus might be different than So you have to measure. How do you measure it?
From the tip of the nose.
from the stomach.
Exactly process. So y'all know this.
No, we watched it.
Okay, so the tip of the nose.
But Professor, I'm sorry to interrupt, but before you continue, can you mention
void
what we need,
process.
all the supplies that we need?
Yes, these are all the
Please.
supplies you need. Yeah.
Yeah,
You get, I mean, the bag doesn't come with those though.
The kit comes just like this.
Oh,
with all of the
everything is there,
supplies.
okay.
Yeah, this is how to give the kits.
Okay,
Okay.
thank you.
When you're gonna do your skills, all of the supplies should be in your kits.
Okay.
Yeah. Okay.
So we're supposed to
pick
have
them
this in our bag.
No,
No,
the bag
no,
doesn't come
you
with
just gonna
those.
get it here.
No. This is
Like
the
in
kit
the hospital,
that
the
you're gonna
kit
use.
would come
In
with
the
it.
hospital, you
When you're in the hospital, you have to make sure that you know what to get because at that time you should already know what supplies to
Yes.
need.
Yeah, but for the day of the test,
You're gonna get a kit.
like this.
okay.
You're gonna get a kit, and the kit should have everything that you need in it already. Okay. All right.
Jenica.
Don't mess with that, cause yeah. All right. So tip of the nose. All right. The earlobe.
Yeah.
And then you go to the xiphoid process. The xiphoid process is the tip right below.
Here.
Void
Yeah.
process?
Xiphoid.
Xiphoid.
X.
Cipher.
Yeah, not
I.
the sternum.
Yeah.
Side point.
Xiphoid.
Xiphoid process. Okay, right below the sternum. All right, you can feel it. So when you go there, so you take note of what it is. So I'll say, for example, 60, right? You have to mark it. How you're gonna mark it? Some people, they use a marker. However you want to do it, you do it that way. But how I do it, I use a piece of tape. Okay, you can have your tape set aside separately prior to even measuring. That if that helps you better, then that's fine. All right, these tapes should be terrible, like terrible, not like terrible. Y'all get it. So of course, so 16. So I'll mark it here. So this is my mark. All right. So I know where to stop. Because you don't want to go too far.
You stop when I'm inside the nose. You have to stop this. You have to stop there.
in that mark.
At that
Yeah,
mark.
I know.
Because that's where you measure it to.
Yeah.
The Zyport process, right? So it's measured, right? All right. So what else do you need to actually insert the actual? Because it's a mannequin, I'm not gonna have y'all do this because they won't follow commands to take sips of water. But initially, for a real patient who can follow commands, you would give them a cup of water and a straw, okay? Because they'll have to sip as you insert. Because why? The gag reflex helps to pull in the actual tube. When they swallow, it actually goes in better, okay? If you think about it, right? Yeah. That's how the food boluses that you have, when you swallow, it goes and all right, and that helps. I'm just gonna go and show you all the other supplies, just so you know what's in here as well. So they do have this that you can put on the patient, so you can use it if you want to as well. You have the tapes, okay? You have the lube. Every kit should have a lube. Why? Because you have to lubricate it before you insert it into your patient. It just helps for it to go down smoother. It just glides, right? Even when you're doing fully catheter insertion, anything that's going into a patient's orifice, it should have some kind of lubricant so it doesn't hurt the patient.
Even
Okay?
animal?
Huh?
Even animal?
Yes. You have to have a lube. All right? Yes. Oh, he laughed. I heard him chuckle there for a little bit, but okay. You have alcohol. You don't really need the alcohol, but that's okay. You do need this. Why do you need it? Because this helps for you to connect, and I'll show you, connect the tube to your patient's gown. If it's not connected to their gown, what's going to happen if they turn their head and they're walking away, is it's going to pull out and okay.
Is this like dangerous, like because it's a pin,
I know, but it helps. You just clamp it onto their gown and it stays there. Even if they turn their head and get up, it stays to their gown, right? And it doesn't pull out easy. All right, so that's that. You can use tongue blade as well if you want to actually look in the back of their throat to see how their throat is, But this part as well, I'll show you. You have to keep this because every kit comes with these. Why? Because this is what you're going to use to connect the suction. You see, you connect it here, and then this part, it connects right to the suction tip. Okay, if you don't have it, then you can't suction your patient. Every kit comes with this thing. Whenever they're going to like a procedure and you have to disconnect them from the suction, this is what you use to clamp it.
To close it?
It's like a IV thing. You clamp it, and then it keeps from fluid from the stomach coming up and then from leaking out. Okay, so that's why that's there. But once you connect it to suction, this just stays open like that. You connect it here, and then this to suction, and then that should suction. Okay. You see? You feel it? Well, you can't feel it, but you can hear it.
Yeah.
Okay. All right. So that makes sense. I know it sounds a bit difficult, but we'll get through it and we'll practice. I was asking the few that were here as well. I wanted to see if there's any other day during this week that we could I can schedule like a 2-hour session that I can come and do it with you all, or like practice with you all. So what day does everyone feel like you should be available? All right, so let me put my tape aside because I want to make sure, because afterwards you're going to need extra tape. I just like to do like this, just put it aside, however much you need, right? All right. Okay, so now I'm going to go ahead and start. Let your patient know, okay, Mr. So-and-so, I'm going to go ahead and start your procedure. All right, perfect. If you feel any discomfort, please let me know. If they start to cough, stop, ask them how they're doing, and then if you have to pull it out for any reason, you can always do that. It's fine, okay? But sometimes when they're coughing, it may mean what?
You in the
in their
lungs.
lungs. They're gonna cough because I can't breathe. Something's in my lungs, right? They have to cough. So you have to pull it up. All right. You have to listen to your patient and watch your patient. I know it's a mannequin, so it won't respond as I need to respond, but it's fine. All right. So this is the procedure. I'm gonna give you guys a list. Not a checkoff list, but like a step-by-step list that's shorter than what's in the book
Okay.
to kind of help you guys. I'm gonna upload it on actually Blackboard so y'all can see it. All right.
Thank you.
Okay. So of course, patient is ready to go. We don't do NG tubes in the mouth because of course there's more germs and stuff like that. Especially if they can still eat. Some patients have NG tubes and they can still eat for different reasons. Okay, because if they're doing lavage or something like that, they can have it in temporarily and then possibly they can eat with it on. All right, and that's okay. Anywho, so now we're gonna start it, right? So as we're gonna start, you tell your patient, okay, Mr. So and so, I'm gonna insert the NG tube into your nostrils. But one thing that I want to mention to y'all as well, you have to make sure, as I told you all before, that the nostrils are not occluded. Okay, if there's a nostril that's occluded, what do? You go to the next one. Okay, if that one's occluded, then that may be a problem. Okay, so let the doctor know, and then they'll figure something out. All right. So if, for example, the one to the right is occluded, you can use a pin light. Okay, and this is where your pin light comes in, and you're all supposed to have pin lights. You can look in the nostril and to see how it looks. All right, and even in the back of the throat as well. But sometimes they do have deformities in the back of the throat as well. So, all right. So I picked the right side, okay, and it's not occluded. It's clear, intact, and you do have to document that, okay. Mucous membranes are pink and moist, etc. All right, good, awesome. All right, so I have this here. I already measured the patient already, as we just did, right? Because that's why I have my thing here. So now you're gonna have the patient put the head back like that so you can see it, okay, and then you insert the tube. As you insert the tube and you head to the back of the throat, when you feel that it hit the back of the throat, this is where you do have them with a cup of water. You have them tilt their heads forward with a sip of water. As you advance after that, they will take sips, okay, and that helps to push the tube even further down.
Sorry to interrupt you,
Yes.
because I see in the video that she tried to twirl it
Because it's a mannequin act,
Mhm.
I didn't do it. But these tubes, I'm gonna pull it out so I can show you. These tubes, they can be hard, and this is why they actually sometimes injure the back of the throat. So they can be really hard. So sometimes to make it soft, they do that. I've seen nurses actually take warm water and soak it in the warm water. I wouldn't do that because then that would put fluids in there.
Yeah.
But what I've done, I've actually done this.
Well,
I've done that, yeah, and that helps to kind of cause it flexible to be flexible. But yeah, but that's why.
okay, so
Mhm.
so they put the head forward and then they start
No,
sipping water.
back, and then once you get to the back of the throat,
Yeah, but once they put it back in the front, is
you
when they
head
start
forward.
Yeah.
Yes,
Then-
when they start sipping
sip of water. Yes. So I'll do it again. Okay. So I just took the loop, right? I'm ready to go in. Their head is still like this, right? I'm gonna take some of this. Okay, and you tell your patient, okay, take a deep breath as I insert. All right, you insert it. Now we hit the back of the throat, right? And now you have your patient to tilt their head forward. Okay, Mr. So-and-so, tilt your head forward and take a sip of water. As you're taking a sip of water, you're advancing even the more. Let me know if you feel any discomfort. If you start to cough, you stop, pull it up, right? So now let's see how far you can go. If you feel resistance and it's not going in, that may mean that it's already in the stomach, but still, well, not still, but stop, okay? And this is where you can actually check to see if it's placed in. So now I've reached my point, right? So how do you secure it?
with a bandage.
With the tape. You all are right. So this is why I had my tape prepared even before. Actually, I'm gonna use it.
She had some type of big bandage.
Huh?
In the video, she had like a big bandage. Like,
Yeah.
Hydrogen.
Yeah. But we don't have that here, unfortunately.
Okay.
What we do in the hospital, and what I've done is this as well. Okay, you don't have to have a specific type of tape.
Okay.
So you do this. So you have your pants, and then you have your belt. This is what we call it, the pants and belt, right? So you put on your pants, right? Put the patient's pants on, right? You secure the tape on top of here, right? I don't think it's gonna stick.
Because of the lubricant, no?
Yeah,
There's no lubricant on the nose, but I guess it's probably the mannequin, because you know it's not true skin.
Yeah.
So as you do, you take one side of the pan and then you twist it around the tube. You see? And then now you take the other pant leg. You go now the opposite way to secure it that way. Okay?
One for one way y another for another way.
Yes, correct. All right. This should stick. So let me put on the pen. I think that this might be a bit too long for his or her face. All right. I don't know what this is, but it's somebody. All right. So and then you put on the belt.
Yeah.
This secures it even much more because then you see
One second.
it's secured, right? This came out, but yeah. Okay. I don't know. I don't think it's a mistake. I think it's the mannequin's skin.
Yeah, the material.
Okay, so that's that part. So now it's in place. So now it's inside. So what do we do next? So now we can secure it with a piece of tape. Actually, before we secure it, let me see. Where is we need a stethoscope. So this is where you all need your stethoscope. Who has the stethoscope here?
In my bag.
In your bag. Okay. Yeah. So for this skill, you need a stethoscope. With your stethoscope, what you're going to do, and I'll tell you, I'll explain to you exactly as you saw in the video as well. So I'm just gonna borrow it for a sec. I have my office. I left it in my bag, unfortunately. But I'm really good. I'm just gonna borrow it for a sec, okay? So what you're gonna do, there's different ways of checking placement. There's auscultating, which is how you do the stethoscope, and then aspiration. All right, so this is auscultating. You take this, put it at the stomach. Do you all know where the stomach is located at? Let me ask you, because I don't know where it's at. No, I'm telling you, some people tell me it's down here somewhere.
No.
But you have to know where the stomach is located.
Yes, it's upper left.
Left upper
Upper
quadrant,
left,
yeah.
yes.
So before you do that, you have to pull back to have 60 mLs of air, all right? And then you go ahead, put the stethoscope to the stomach area. Of course, you have to have this in here. You connect this to the tube. All right, and this is where you have to be like multitasking. All right, all right. So as you have that there, you have to push hard. When you do that, what do you think is gonna happen?
You can hear this.
You hear air going into the stomach. Okay, so this is a way that we normally do it, but sometimes they say it's not the best way. Why? Because even if you do that, you can hear air in the lungs too when you do that. So this is why they say, you know what? Let's just do it. Just do the X-ray.
How much do you put?
60 mL of
60.
air.
60.
Okay. And then you
So just air.
just air, no water, no fluid, because it's not confirmed that it's in place.
Yeah, and
So we have
auscultate.
to be sure. All right. So once you do that part, then you're done. So that's one placement. Another.
When you put the 60 mLs of air, right, then it's gonna want to come back out, right?
No,
No, you
it's air.
inject.
It's air.
You inject and auscultate.
Yeah, because it's in the stomach.
Yeah.
There's if it's at the tip of the stomach, there's not fluid that you're
You know, like when you put like the air into the vial to take like medicine out, like
no, that's different.
then
That has
medicine wants to come
pressure.
out.
Yeah, that has pressure. For a reason, but this doesn't have any pressure in like that.
So you're supposed to feel something when you practice the
You
bear.
have to hear air, like a
When you auscultate, yeah.
yeah, because it's air going inside the stomach.
Yes.
And it's going fast, so you have to hear something. I wish I could do somebody, but I'm Another way is aspiration. So you just connect it to here, and then you pull out, and you should see not like that. Sorry, I pulled too far. You should pull out, and then you will see that there's stomach contents that come up. It can be different colors. If someone has blood, it will be like a dark brown reddish color. If someone has
Not
food,
suction, right?
bitches ate, and it's green. You should know.
Do you know how much to aspirate? Like, I mean,
You can aspirate how much you need. If you have to send for testing for lab or stuff like that, then you
Aspirate.
do that. Because sometimes we draw up to send for to see that if there's blood inside of it. Yeah, or if there's any kind of infection or stuff like that.
Which
Yeah.
one we are gonna do? The syrup cup or with the syringe?
You can do both.
In the test?
Yeah,
Both of them.
so no X-ray. We can just verbalize the X-ray. No.
you can verbalize X-ray.
Okay.
You can say I would confirm two ways, either with auscultation or aspiration, and you can do it. And then you'll say, but it has to be confirmed definitely with the X-ray. That's it. Easy, right?
Well, sometimes you have to check like the residual gastric.
So when a patient's receiving meds or not meds, but
Fluid?
like
I mean,
feeding, right? You want to make sure that they're tolerating their feeding effectively, because sometimes they're receiving fluids. Oh, you okay? They're receiving fluids, and then they're not digesting it, and it just sits in their stomach, and that's how they aspirate it. Because of course, if it's not being digested, what's gonna happen to it? It comes right back up, right? So you have to check for residual, and that is called residual. This is where you
But that's after. We are now just confirming the place.
yeah, that's only because he asked a question, so I'm just answering
Yeah,
his
yeah,
question.
yeah.
So that's only if they're on feeding.